It's a live stream.
Hey guys, what's going on? It is the Twin Doctors, Dr. J, Dr. I, and we are back again. So just want to give you guys a little bit of background on what we're hoping to do moving forward. Hopefully you guys have seen our new show on Fox called Second Opinion with the Twin Doctors. And one reason we do this is the same reason we do the show. We love to connect with people. We love to educate. We love to entertain. So we had the idea, rather than just having guests on the show, we want to actually help viewers of BDO and the show connect with our guests. And so ideally what we're going to be doing within 24 to 48 hours of each show, the show airs on Mondays at 7 p.m. Central. We're going to do kind of a little after show get together where we unite viewers with the guests from the show. And that'll give you guys an opportunity to do a few things. Number one, we can do like we always do. We can just chit chat, you know, we'll ramble on about things that are relevant in health and wellness. And you guys will send us your questions like you always do. We love the questions. We love the engagement. We love the opportunity to connect with you guys. But also, and this is really the cool thing, you'll have an opportunity to connect with our guests.
And they're infinitely more interesting and wiser than we are. So we're bringing the A+ game with that.
Yeah. We've been lucky enough to get some really cool guests for the show. And they share a lot of cool information. But the one thing that I found doing the show is you never get
those questions answered. Like there's still a million and one questions that are left to be answered.
Yeah, exactly. when we're prepping for the show, and the show is always about 42, 43 minutes, an hour when you include commercials, but just without the commercials, 42, 43 minutes. We always have tons of questions on our little note cards. And if we're lucky, we get through half of them. And so I'm always feeling like, hopefully it was a good show. Hopefully the people feel like they got enough. But if you didn't, now you have the opportunity to connect with the guests. Now, no matter what, even if you don't watch the show, we're bringing some amazing guests on. You're still going to have an opportunity to connect with some amazing minds.
Yes.
But if you watch the show, it's kind of cool as well. Because
it's like doing your homework, right? You already come with your questions.
There you go.
So you got to watch the show.
Exactly. So you kind of know what we talked about. And then if you want to add on, you want to ask some additional questions, you want some additional follow-up on things that we didn't cover, because it's funny. When I watch the show, I'm always thinking to myself, oh my God, I should have asked this. Should have asked that. This follow-up question. I should have asked that follow-up question. So I know when you guys are watching, you guys are thinking the same thing, like, Dr. J, why didn't you ask this? Dr. I, why didn't you ask that? You just write down your little notes. And then when we come on the Facebook Live with BDO 24, 48 hours later, you can connect with these guests. So again, I'm just going to put in one more little plug, and you guys know how this works as well.
So I'm not being rude. I'm not like just ignoring Dr. J and looking at my phone. I'm waiting for your questions.
Exactly.
So send us your questions.
I was going to say, you guys know how this works. Send us your questions about any topic, but in particular, we love questions related to the topic that we covered on the last show. So for you guys who didn't watch, the title of the last show was Surprising Health Risks and Benefits of Tattoos.
Yes.
In the first portion of the show, we connected with the dermatologist who talked about some of the surprising health risks of tattoos. And that was interesting. You know, a lot of it was stuff that I think a lot of people would have probably intuitively assumed might be health risks associated with tattoos. But still, it was very interesting information. Second half of the show, we wanted to talk about some of the surprising health benefits of tattoos.
And I have to say, this is a part of the show that I found like super interesting, because I have to profess my ignorance. Like I did not know that there were so many medical uses for tattooing. And really, and we have a great guest with us, so she'll probably correct us. I don't even like the word tattooing. I guess medical tattooing, but it's really more like reconstruction. It's like medical artwork.
Yeah. Well, the technical term of it for it is paramedical tattooing.
Yes.
And so paramedical tattooing involves the use of tattooing to address all kinds of medical issues. And I will say, you know, one thing I like about doing the show is it has forced me to learn things that I ordinarily might not have learned. And so when I started to do research about paramedical tattooing, I was blown away.
Yeah.
I had no idea. I mean, I kind of knew what paramedical tattooing was loosely, but I really didn't know. But I really had no idea about all of the things that paramedical tattooing could address. And like Dr. I said, I was going to say, we've got an amazing guest on. Her name is Liana Resnick. So she has a paramedical tattoo practice in Highland Park, Illinois. It's northwest suburbs of the Chicagoland area, called Fancy Schmancy. And she is a paramedical tattoo artist. And she taught us a whole bunch. So, and we're going to let her really get into it. But just to provide a little bit of background, paramedical tattooing can be used to address really any blights or any issues related to the skin that might cause visual distress for people, right? So one thing that she told us that paramedical tattooing can be used to address, and I was shocked and kind of happy to hear it, because I suffer with this myself, was stretch marks.
I was gonna say, which one are you talking about? There's so many
I was
things,
gonna
but
say-
okay, stretch marks. Go on to stretch marks.
So,
Okay.
so you can use paramedical tattooing to address stretch marks, which I was really surprised about. Another thing that affects the African American community probably disproportionately is vitiligo.
Right. And so, just so that for people that don't know necessarily what vitiligo is, although a lot of people do, especially with Michael Jackson and all that, but vitiligo is a condition of the skin where you lose pigmentation, right? So all of us, regardless of our skin tone, have pigmentation. Some of us have more, some of us have less. But when you lose this pigmentation, you have areas of your skin that look almost pale or pinkish, depending on what your normal skin tone is. And so people that suffer from vitiligo, it's a really difficult condition to treat. You know, you kind of have flares. It kind of comes and goes, but it's not even. If you've ever seen somebody with vitiligo, it's not like there's just one area of the skin that's a perfect circle or perfect square. It's very uneven, and it is distributed throughout the body. And so for people that suffer with vitiligo, it can cause quite a bit of emotional distress. And so, not to cut you off, but I wanted to kind of give the background.
Oh, sorry. I'm just one of our guests, Vivian, who's a patient who had breast reconstruction with paramedical tattooing after mastectomy, just actually sent me a text. She's supposed to be joining us, so I'm not being rude. I'm just going to send her the link. We're going to resend her the link.
But yeah, so a lot of folks that have vitiligo, it causes a lot of emotional distress. And the reality is there aren't a lot of good treatment options when it comes to vitiligo. There are treatment options that kind of help to mask some of the manifestations and help to improve the manifestations, but there are very few treatment options that will have you going from a depigmented area of your skin to an area of the skin that looks completely pigmented. And so what Dr. J was talking about, one of the really interesting things that we found with paramedical tattooing is that, and it kind of makes sense if you think about it, but again, it's not something that ever occurred to me, but if you have areas of vitiligo, especially if it's recalcitrant to medical treatment, or even if it's not, if you want to do something that's a little bit more long lasting, you can actually have those areas tattooed. And it kind of, if you imagine, like, you know, this is my skin tone, right? And if I had an area here that's basically depigmented, so it looks very white or pink, you could get ink that matches my skin tone to cover that area up. So super, super interesting use. And like Dr. J said, stretch marks,
scars, which is another thing, you know,
yeah, that's a big one.
C-section scars, self-harm scars, really any blight, any scar can be used to treat that. But I think what I probably found most interesting—
said that backwards. It can be used to treat any blight or scar. And they know what you mean.
All right. But I think what I really found most interesting was the use of paramedical tattooing as part of breast reconstruction after mastectomy. And what a lot of people, you know, maybe don't realize is when you have breast cancer and you have a mastectomy where the breasts are removed, most people know that you can do a reconstruction. You can basically add fat from other parts of the body into the chest. You can do implants. You can do things of that nature. However, one issue that a lot of people will run into is you can reconstruct the breast, but reconstructing the nipple and reconstructing the areola can be challenging sometimes, and sometimes it can't be done. Sometimes the nipple has to be removed if the cancer is involving the nipple. And so even if you have the breast, you don't have the nipple. And so the ability to use paramedical tattoos to reconstruct the breast, I think is profound.
And the thing is, and even when I learned about that, like I will caveat, I am not a great artist, okay, at all. So maybe what I can envision is limited by my very limited artistic ability. But what I envisioned in my head with a reconstructed nipple and what it actually looks like, it is
amazing.
Amazing. It is amazing.
Yeah. And one challenge we had when we did the show, obviously, was we couldn't show the before and afters on television because some of the stuff just wasn't appropriate for television, especially it airs at 7 p.m., kids are up, and so on and so forth. But we did actually share on our socials earlier today. So if you want to find it, you just go to the Twin Doctors on Facebook, _ on Instagram. We shared some of Liana's amazing before and afters. And so you can go and check those out later. You know, Idris made the joke during when we were taping the show. He said, we're gynecologists. Part of what we do all day is look at breasts.
Yeah. But I know where you're going with this, yeah.
And when you look at these before and afters, obviously—
I was popping in my glasses like,
I mean,
which one is it? Yeah.
You would think that there is a three-dimensional nipple. Like you look at it and you cannot tell. You cannot tell that there's not a nipple there. So honestly, check it out. So like I said, you can go on our socials on Facebook. It's just the Twin Doctors. on Instagram. It's the Twin Doctors _. The post was from earlier today. You'll be able to see it. Also, Liana on her social, she has tons of it as well. So,
I was gonna say she's here. Why don't we let her do the talk? I'm gonna keep an eye out for questions, and as questions come in, we will definitely mention them and answer them. But while we're waiting to get those questions, why don't we let her kind of tell her story, because she can tell it so much better.
Yeah, so I'll introduce her. So like we said, her name is Liana Rusnick. She is the proprietor of Fancy Smancy, a paramedical tattoo practice in Highland Park, Illinois. And she does some amazing work. So Liana, why don't we just start by telling people what paramedical tattooing is all about?
Well, it's completely different world than what we know as permanent makeup. So as we were talking about it in our TV segment, that we have permanent makeup, it's like eyebrows, microblading, lips, eyeliner, and then there's the paramedical pigmentation. So we actually target everything that concerns scars, stretch mark, areola 3D after mastectomy, any type of areola correction after any type of surgery, anchor scars, lollipop scars, and vitiligo camouflage.
Okay.
What else? I'm thinking, no, hold on. I forgot it on our TV segment. Even nail beds, if someone actually doesn't have a finger and there was cut off or something, so we actually can do a nail bed that actually looks surreal.
Okay, I've actually seen that.
I was gonna say I saw, and it may have been on your page, but that I saw that and I was like, that looks. It was amazing. Yeah, I really, again, I couldn't really tell the difference. Like it was, amazing. So lots of uses for sure.
Yeah. Now, when I was doing my research initially, I found that paramedical tattooing kind of began when people were looking for ways to account for hair loss. So basically it was used to kind of create the image that people had hair when they had hair loss. And then it really kind of took off, correct me if I'm wrong, but in the 90s, it started to really take off and people started to use it for a lot of other things. So one thing that I found interesting, and we kind of talked about it on the show, was paramedical tattooing. You want to make sure that you're going to someone who knows how to deal with different skin types.
Yeah.
And one thing that I was impressed with Liana was she mentioned that obviously not all skin is the same. And pigmented skin, so African-American skin, responds very differently to a lot of things than non-pigmented skin. And we kind of touched on it in the show where we talked about what's called the Fitzpatrick.
We have a question for Liana, so I'm going to ask. Okay, so Kristen Vaughn Robinson has said, wow, Liana, I looked at the before and after images. What is the most, this is a good question too, what is the most unique paramedical tattoo that you have done?
Oh my God. Okay. I will share it, but of course I cannot share any photos. But I did a camouflage vitiligo on a vagina where there was loss of pigmentation. And also, as I have 3 languages in my head, I don't know how to pronounce it correctly, but when we have someone that is a trans and changing their gender and becoming from a woman to a man, so actually I camouflage down there to have it in the same color after surgery.
Oh, okay.
Okay, so you're saying this is somebody that's transitioning from female to male.
Yeah.
And so basically you camouflage the vagina and the vulva so that it was just the same color as like abdomen and legs and everything else.
Yeah, and if they have the penis, so I camouflage actually the penis and to have a 3D on the top, like we're doing 3D areola. So we're doing as well this.
Wow. Okay.
But I was not mentioning it in our show.
Yeah.
That's why I have to go to the after show to get that.
Let's come to the after show. We talk about all the stuff you can't talk about on nighttime TV. So, okay. And that's actually kind of interesting because we do see patients from time to time who have a lot of discoloration of the vagina and the vulva. There's one condition in particular.
Can I go back for 1 second? So wait, so you did a paramedical tattoo of a penis?
Yeah.
Okay. All right. I just trying to clarify. Okay, go ahead. Sorry. I was just trying to clarify.
I got a question.
Yeah, I've got more questions. No.
But there are conditions you can see where you get discoloration of the vagina and the vulva. There's a whole group of conditions called lichens, L-I-C-H-E-N, and it's basically almost like autoimmune conditions where you have the immune system attacking the vulva, attacking the vagina, causes discoloration, and the tissue gets very pale and very atrophic. And no matter what you do in terms of using steroid creams and things of that nature, you can address the symptoms associated with it, itching, discomfort, things of that nature, but you never really regained that color or that appearance. And you have a lot of patients who really are distressed by that
Yeah.
because,
Mhm.
they say if the vagina doesn't look like it once did, they feel like it affects
Yeah.
their self-esteem and how their partner may or may not view them. So you can actually do paramedical tattooing on the vulva and the vagina.
Yep.
Wow. Okay. All right.
Yeah.
Now it's gonna sound like maybe a bit of a silly question, but I was thinking about this anyway because when I was looking at some of the videos, even when you're doing paramedical tattooing of the breasts, it's kind of sensitive tissue.
Yeah.
How do you prepare whatever part of the body you're going to be doing the work on? How do you prepare it so that it's not painful, it's not sensitive? Because I know a lot of people, even when they're just doing tattoos for fun, one thing they
Yeah.
worry about is
The
pain
pain.
associated. And I've even heard of people getting like sleeves and things like that who will get general anesthesia where they just get knocked out.
Mhm.
So how do you prepare the areas to keep people comfortable?
Well, it all depends on the area. If we're talking about actually 3D areola after mastectomy, so most of the patients, they actually don't have any feeling. So they even don't need to have any numbing. There is no any feeling. Now, there is some areas, maybe there is still some nerve. So to be, for just in case, in the consultation, I'm checking everything, and I also check sensitivity with the needle to see if they're feeling something or not. If they feel in specific areas, so I have it on my notes, and then when the day of the procedure actually comes, so I will apply topical numbing. If we're talking about scars, if I need to do camouflage scar or the inkless, it's a preparation for camouflage if needed. I can apply numbing if they really want it, but sometimes they even don't have any feeling on that area at all. There's
Yeah.
like nothing.
A lot of times after surgery, yeah, you just don't have any feeling. So so we've got a follow-up question. So this may be a good time to introduce Valerie. She can probably, I'm sorry, Vivian, good Lord. So sorry, long day, Vivian. This is probably a good time to introduce her. She can probably tell us some of her experiences, and then I'm gonna get to this follow-up and then she can tell her experiences, but go ahead.
Everybody, this is Vivian. So Vivian is the patient I was telling you about a little bit earlier who came on the show with Liana. And I'll just do a very brief synopsis because she can tell her story a whole hell of a lot better than I can. But basically, breast cancer survivor, had a mastectomy, had breast reconstruction. There were some issues. I'm not stealing your thunder here, though. So can you just tell people a little?
Do you mind if I just ask a follow-up question real quickly, and then we'll let? Okay.
Yeah, absolutely.
So the follow-up question that Kristen Vaughn Robinson had. Okay, she said follow-up. So you mentioned 3D. How are you making it 3D, or how are you giving it that 3D appearance?
Well, it's all in the end of the day, it's an art. It's something that you learn, and then you just practice with the years. I practice medical pigmentation already for the past 16 years already. So I already learned so many techniques, and I developed my own way of language of working with different areas of brushing and dotting, and it just by visually by the eye. In the end of the day, it's everything what we see. There is actually another procedure that I personally do not perform, but a colleague of mine, and it's actually to have a nipple projection with injections. So I do the 3D areola, and it looks a 3D, but it's actually flat. But if they really want also to have something that actually will project it, so then she's coming to the picture, and then she will do the injection, where I also will recommend her where the glands that I did a little bit of a white and shading, and in the nipple itself. But in the end of the day, it's completely flat. How I do it, I will just be honest with you, is just practice. And I only see nipples in my sleep. This is what I see: only areolas and areolas and areolas and nipples.
And can I guess my own follow-up question. So when patients are having the paramedical tattooing done for nipple restoration, but you mentioned that you have a colleague that actually can, do the 3D effect, like with injections, injections. Yeah. Can you do both, or is it one or the other?
Well, you
or is
can
there a
do.
need, I guess, for both if you're doing the projection?
Yeah, because she can do the projection, but there's no any areola over there, because after mastectomy, most of the patients actually their areola is being removed. There is some cases where the areola actually is there and it was saved, but maybe this areola is disformed in some way, so I need to correct it with already what I have. But most of them, there is no any areola that is being saved.
So the projection is the 3D effect, but then
no.
Yeah, the projection is what gives the actual projection, but then you still do the for the areola.
So the tattoo is what kind of gives the 3D effect. The projection just causes it to raise from the skin, so it'll basically feel
Correct.
like a
If they want to
nipple,
have
someone
something
touching.
out. But most of the patients, to be honest with you, this is just like an extra if they want it. But all
Mm,
the patients, in the end of the day, they're actually happy that it looks a 3D. They don't care that it's flat, but
right.
Yeah.
it's basically there. Yeah.
Gotcha. Okay.
Hmm.
Well, Vivian, can you tell people a little bit about your story? It's a very interesting one.
I do apologize for the lighting. I just came out of an appointment and I'm in my car.
It just makes you look
So
mysterious. It's good.
so bear with me and I apologize. I thought I would make it home before that. Well, I did have a bilateral mastectomy. I went through a journey. Shh, shh. I went through a journey where they couldn't save my nipple. And I went to Liana for the 3D. Okay, you fixed it. I'm sorry.
It's all right.
I apologize. I'm with my
No, it's all
grandson.
right. Please, it's all right.
Um, so I had the consultation with her. She was very detailed. She explained everything to me. And we went ahead when the doctor released me, we did the tattooing. And I can vouch for her that it looks very, very real. I
Mhm.
didn't opt for the injection as she was talking about, but I do have an appointment with her to I want to freshen it up because like I said before, I am engaged and I'm going to the next process. So when the reveal time comes, I want to make sure I'm at my best, right?
Yeah. Yeah.
So it was an interesting journey because we did have some problems at first with insurance because like
Mhm.
not a lot of people are aware of this. We had to deal with some procedure codes. We took care of that and you know, to God the glory, everything was taken care of. And she was able to make me feel like a woman again
Yeah.
because I think
And
that's a area where I apologize that some
okay.
women don't understand because they're so caught up in their emotions because
Mhm.
of the horrific situation, right? Because removing both of your breasts is not easy.
Yeah.
Image wise, it's not easy.
Mhm.
So like I said, she made me feel complete because
Mhm.
yeah, you have a reconstruction, you have implants, but yet you're still missing something, your nipple.
Yeah.
So her completing that for me really did a big difference in my life, and that's what
Mhm.
I want to let other women know, that there is so many treatments and things that we can look into and not feel um that we're not whole or complete.
Mhm. Mhm. You know, Being a breast cancer patient and now a breast cancer survivor, I imagine the journey as a difficult one physically and a difficult one emotionally.
Mhm.
Um, what was more difficult? Was it the physical journey, the surgery, the recuperation, or was it kind of the emotional toll and the emotional journey that you had to go on?
I can speak for myself. It was both because I
Hmm.
did have some complications
Hmm.
because I do have other medical issues.
Hmm.
So for me, it was an emotional, a visual that I was really struggling with. But
Hmm.
when I ended up doing this, it brought me some peace of
Yeah.
mind, if I could say that.
Hmm.
And again, the visual of you're not the same. I was very big chested. And then I chose to go to a smaller size. So all that messes with your head.
Mhm.
Yeah.
Like, okay, I don't look the same. It's
Hmm.
bad enough I'm not the same size. But because breasts are heavy, they also
Hmm.
give you other complications like back pain and
Hmm.
things like that. I chose, let me go a little bit smaller
Hmm.
versus having all that weight. I already went through numerous surgeries. I
Yeah.
just wanted to feel complete and be done with it, if I may
Hmm.
say that.
Of
Yeah.
course. Yeah. Yeah.
Got a question.
Yeah.
Did you want?
Oh, you have a question?
Yeah, I have a question. But did you want to say something
Oh,
before?
no, go
Okay.
ahead, go
Okay. So this is a follow-up question. This is actually a really good one because to preface the question, I think that a lot of medical practitioners, a lot of healthcare practitioners don't really know about this at all, or if they do, they don't know that much about it. Okay. So her question is, this is Kristen Vaughn Robinson. So she said, how do you find someone to do this type of service if they don't live like in your area? And how common is this work? And I think that's a great question because I'm sure there are going to be people who are going to be educated and hearing about this for the first time tonight, like we were. How do you find somebody to do this? And I guess the other question is, how do you find somebody reputable to do this? And how common is this work?
It's a question for me, right?
Yeah.
Well,
Sorry.
first of all, let's talk about the location. So I'm, for example, here in Illinois. However, I have patients that flying specially to me for those procedures. But there's also artists like me that also, I have another location, as you know, and I shared with you that it's in Miami with the celebrity doctor, Dr. Hodgkin from the Housewife of Miami. So I have a location over there where I also work with him side by side with our patients over there. So there is artists like me that can travel and have this location, or there is actually patients that will travel specially for a specific artist. Now, let's say you don't want to travel, and it's completely fine. What is important for you is, first of all, as everyone, is to Google, right? Because Google is the first thing that you can catch up and to see what is specifically the search. It's not like an ad or something like that, right? So you just need to write areola tattoo, nipple tattoo, cancer, nipple tattoo, like specific keywords. Now, of course, you will start to have already a list. And now this is your homework. This is where you actually need to check individually what is the person. So first of all, it's very important. It's not just photos before and after, because maybe it's not their photos. It's happening, unfortunately, a lot. I had so many cases that I took it even legally that people were using my own photos of my own work as them. So I used to do copywriting. So I already learned everything, right? So you need to check photos before and after. You need to see reviews, and you need to have consultations, because in the consultation, this is where you're asking all the serious questions. And by those answers, you will able to identify if this person actually know what they're talking about. And also experience, if you have someone that have 16 years of experience like me, or someone that have 3 years of experience in me, maybe that we don't have the same experience in years, but maybe we have the same knowledge and the academic in this industry. So it doesn't matter even if you're 1 year, but you need to know what you need to do. So you need to check about aftercare, what is the pre-care, if they know about any type of autoimmune diseases, because in my consultation, I'm very thorough. They're taking 1 hour, like 1 hour, when I have students that taking my coaching and want to learn it and to add it to their clinic. They say, okay, so we will do a consultation like with eyebrows, like 20 minutes on the day of the procedure. I'm like, no, what are you talking about? Even when I do eyebrows or any type of permanent makeup, I have 1 hour consultation, because I need to explain them the pre-care, what is the aftercare, what to expect, to see their skin type, to understand and to analyze what exactly they're looking for, to see if they're even a candidate for this type of procedure. Because as we were talking in our show, the mental health, it's a process, it's a journey. It's not like nails or hair that you walk in, you got your nails and your hair done, and you walk out right away with results. It is a process. So if you ask me what are the main questions that you need to ask your potential artist for those type of procedures, is what are their recommendation? Because as you remember that we were talking, everyone jumping right away for camouflage. But there is another procedure that it's recommended, and maybe camouflage even is not needed. But why camouflage? Because it can be easy money. It can be something quick. And this is where also the ethical perspective is coming. For example, I had a patient today that drove 4 hours just for a consultation with me, and they had a consultation with someone else in their area. And they said, well, they said that they can do camouflage. And I'm like, no, you even don't need it. What are you talking about? Like, we can do something else completely, and to avoid, another process, another, extra money. So it's all about to check experience, the pre-care, aftercare, what are the recommendation. And I always say to my clients that are coming to me, get another opinion. Get another opinion that you will get, you will find basically your artist. Because for me personally, I will be honest with you, and Vivian knows that I'm very picky. I check if I have this connection with the client. If I don't have a connection with the client, I prefer to decline them and that they will find this artist, because in the end of the day, it will not take a week or two. It will take a few months up to a year. Maybe it depends on the difficulty of the case, that I'm going every step of the way with them in this journey.
Yeah. And one thing that you had mentioned as well is when you're trying to determine who's the best paramedical tattoo artist for you, it's seeing their work, and not just like you said online, because people can steal pictures and so on and so forth, but it's actually going in, having a consultation with them. And I know that Vivian had said that when she initially was doing her consultations with you, you had shared images of work you had done previously. Do you ever put patients in contact with past patients to kind of share their experience?
Yeah, if they're asking that, so I have patients that actually agree that I can share their information. So I always ask also patients, if you would like, you can actually talk to one of my patients and to see how was their journey, their experience, and to see if it's something for you. And to be honest with you, in my history, I had only 3 that were asking, and I did it. But of course, again, I asked the patient if they're still interested to share their information. But I will just be transparent. After consultation with me, I think I'm explaining so many things. I'm showing so many things. For me, it's important that they will trust me. If there is no trust, it's better just even not to start with this. Because again,
Yeah.
it's not about money. Because if we're talking specifically with cancer patients, we have insurance involved. This is not a game. This is an extra process for me to work extra out of my work, because let's be honest, most of the tattoo artists, they provided the procedure and they say, okay, bye. Take care of it, like figure it out by yourself. I'm not like Vivian can give it her testimony. I was working like evenings, calling. I was on call every day with the insurance and with the specific doctor, because they were not willing to provide this referral. And I said, listen, guys, I'm going to be on your head every day. I'm not letting it go. So it's very important to see who actually is very into it and who wants to put this effort for the patient.
Yeah.
So I'm sure there are a lot of people that are watching or that will watch that are themselves either going through breast cancer right now or survivors of breast cancer. I don't know which is the best question to ask. Is there a person who's a better candidate for it, or better yet, is there a patient that is not a candidate for this? So is there a patient or a person that's watching this and maybe going through it now or that has gone through it who you would say this probably is not for you? Or is this more or less open to everybody who is interested?
It's open for everybody. In the end of the day, it's the decision of the patient. And I will call them client because they don't like to call patients anymore, because it's a journey for them. So I will call them clients. In the end of the day, it's their decision if they want to have it. But I will show you another thing that I'm actually just getting out with this, because it took me a while to work on this. If there is clients, I'm sorry, that don't feel comfortable or they're not ready for any type of areola tattoo, so we can do a areola, how do you say it in English? Oh my God, I forgot. Oh my God.
Prosthetic.
Prosthetic. Oh my God. Prosthetic areolas that they can have it, for a week or two, and to all the time to wear it until they actually will be ready to have a tattoo. But from my experience, everyone are actually ready and they are good to go.
Yeah, I would imagine most people who seek you out, they've already gotten to a point emotionally where they know, like, this is the next step I want to take. So I would imagine doesn't take much convincing. So, Vivian, I know that you said that when you had your breast reconstruction done, initially when you decided that you were going to go that route, people didn't quite understand what it was that you were doing. Did you find, first of all, for yourself, that you had to kind of reconcile the fact that you were going to be including tattooing in your reconstructive process? And did you find that you had to convince other people that that was like a sensible approach to take?
Well, I was considering tattooing from the get-go because I wasn't aware of this type of tattooing.
Yeah.
So I was already creating a design in my head. Well, let me make them look beautiful one way or the other. I cover the scars and call it a day.
Mhm.
But it was more than that for me. I really wanted to feel complete. And that's where the emotional comes in. And then when I found her, I sat down because my kids had a meeting with me prior to my surgeries, and they were in agreement with me on everything I was deciding. So I figured they went through all this journey with me. I also want to include them in this.
Yeah.
So once I sat them down, it was like, okay, what are you talking about? So I
Mhm.
had to go and show them, and they're like, "Oh, that's pretty cool. I didn't know that exists." And
Yeah.
until you go through the journey of having breast cancer, there's a lot of things that you are not aware of. And
Mm.
if you don't do your own research as to, okay, this could happen, that could happen, well, how am I going to feel afterwards?
Mhm.
I really feel that you really have to advocate for yourself and get the
Mhm.
proper knowledge that you need in order to go through a process like this.
Yeah.
So
And
because again, I wasn't aware that Liana existed, and I thank
yeah.
God she existed
Yeah.
because she's been a lifesaver for me.
Yeah.
Okay, so in that process, it is a complicated journey, and everybody's just focused on the cancer, on the cancer. Well,
Mhm. Mhm.
okay, get rid of them. And yeah, it's okay. Get rid of them because you want to protect yourself. You want to get rid of the cancer, but they don't understand what comes
Mhm.
with it
Mhm.
afterwards.
Yeah.
The
Yeah.
emotions, the image per se of yourself.
Mhm.
Give me 1 second. Give me
Oh,
one
of course.
second.
Yeah, of course.
Kids.
I know. I know.
I'm sorry. I
No
want
worries.
No,
you
it's all
to
right.
be
Don't worry
able
about
to
it.
hear me, and he's playing his iPad. um so it's all the visual, the emotions, the
Mhm.
acceptance of what you're going through. So
Mhm.
the all that is key when doing this process. And
Mhm.
when I did have my consultation with her, I felt her genuine.
Mhm.
And not only genuine, she was very detailed. And
Yeah.
in that process, you need someone like that. You
Of
don't
course.
Yeah.
need someone to see you as a number,
The number. Yeah.
because
Yeah.
you guys are doctors. There's some doctors that you become just a number to them.
100%.
Oh yeah.
Yeah.
And
No,
I
you're
100%.
very
have
right.
doctors that they become family to me
Mhm.
because they have constantly treated me. It's been years.
Yeah.
They know you better than anybody else.
Mhm.
And you don't want to feel like a number to someone. You want to feel
Mhm.
like, oh my God, this is something important to her.
Yeah.
Let me help her. Let me
Yeah.
be
Yeah.
there for her. And honestly, that's what I felt the moment I met her. And
Mhm.
I'm not just saying this because she's there. I am
Yeah.
saying it because it was a very hectic journey for me.
Yeah.
Oh yeah.
Yeah.
And I really received that from her.
Yeah.
Oh God, I'm getting
Yeah.
emotional.
Yeah.
Well, I got the question.
I'm
So,
I,
always like this because I can
yeah.
feel
Well,
it.
I will say, I think I'm a pretty good judge of character. And from the moment I met you, I could tell that this was genuine for you. And you had alluded to, and we don't have to cover it today, but you had alluded to the fact that you helping other people heal was helping yourself heal because of issues that you had dealt with in life. And I think that that's super important because you become
Yeah.
emotionally invested in your patient, and when you're emotionally invested in your patient, you become a partner in their care. And I'll just say very quickly, because I know we have questions. One thing you did say, Vivian, that is very true though, is patients have to advocate for themselves because information and knowledge is coming at all of us fast and furious. And I'll be very honest with you. I think I'm a pretty good doctor, and patients will sometimes come in and say, "Doc, what do you think about this?" Boom. And I look at it and I'm like, "Oh, I haven't heard about this yet." I'm like,
One
you
minute,
know,
please.
yeah, no, exactly. 1 minute, please. I need to go to the restroom. And they, but no, honestly, information is coming fast and furious. And when it comes to things, especially like paramedical tattooing, if a patient came to me about that, I might have some general knowledge, but not a whole bunch more than that. And so advocating for yourself is absolutely
Crucial
important.
in all aspects of life, including in medicine. We got a couple of questions. We're gonna get back. Okay, so we have one more question about. Sorry, I lost my place here. All right, so the risks. What are the risks of doing tattooing after you've had breast cancer? So, are there any risks to tattooing the breasts, or after you've had breast cancer and you've been treated for breast cancer?
That's a great question.
Yeah, and well, we can start with that one.
Well, first of all, let's talk about the type of ink that is being used. It's not regular body art ink. It's specifically lines by specific brands that were made for specifically to work on any type of scar, or for people that after any type of radiation, they don't have very heavy metals, and they are safe and approved by, they after regulation of FDA. If they were not regulated, they will not. It will be illegal to use them, and of course, we will not take, the chance for that. And also, we have a clearance by the doctors, because in the end of the day, doctors also have their own education, right, and knowledge. If they believe that it's something that will be unsafe or will make the cancer to return, of course, this is something that will never even will be offered. The very important thing also that they're not clear right after a month or two after the surgery, right? They need to wait for the clearance for the doctor, that it's usually like post-surgery 3 months to 6 months. And it also depends if there's any type of scars that on that area or not.
So that's actually, so you're not using normal tattoo ink when you're doing paramedical tattooing. I didn't know that, but that makes sense because normal tattoo ink has a lot of stuff in it you wouldn't necessarily want in your body.
Exactly.
The heavy metals, like you said. So, okay, so it's a unique ink for paramedical tattooing, and you don't jump into it right away. You wait until they've healed from surgery, maybe have stopped chemo, immune systems are up and active again, and the doctor's cleared them. So, okay.
And this is another interesting question. Okay, so do you also get people who don't want to reconstruct it to look like a breast, but just make something different, kind of like a flower or anything out of their scar? Do you strictly only do like areola reconstruction, or what have you seen in the past? What requests have you had?
So there is an option to do like a bra tattoo that is very pretty. It's actually to have like flowers and everything. This is something that I don't do a lot, only because I really like the areola look than to have like more flowers. I can do some little flowers with the areola. I had a patient that her niece lives in Florida and she's here in Illinois, and for her birthday she actually had her areolas done with me, and she asked me, "Hey, Liana, can you do a little heart on the side?" I'm like, "Of course, but what does it mean?" She said, "Well, my niece today got result, and she was diagnosed with cancer as well, but now she's free like me. So right now, when I'm having my areolas with you, she's having this little heart in the same location where I want it." So they were doing live when she was doing this little heart and I was doing this little heart. So I can do those things. I don't jump right away for big, huge body art on the area because it looks beautiful. But if someone is not used to something like this, if it's there, it's there. That's it. There is no any way, to remove it, only if you will start to have lasers and all those other procedures that we know that no one wants to go through after radiation or chemo. But it is possible. Yeah.
Okay. So we've got two questions. So I'll go to one that's a little bit more related to what we're talking about first. Okay. So is it better to get a tattoo with no color, or does it matter? And what's the fastest way to heal after getting a tattoo?
Again, if
So
to do no color,
areola reconstruction, you have to have color, obviously, because you're going for this 3D effect. But in general, when you're doing paramedical tattooing, is it better when they say no color? I'm not sure if I understand what they mean by no color, but is it better to get a tattoo with no color, or does it matter? Or maybe is there a specific dye that's better? So on the breast, we said we're going to use a dye that doesn't have heavy metals. For all of your paramedical tattooing, is that the case? Are we all using dyes without heavy metals, or is it more just
maybe they're referring to the inkless, what I mentioned before. So an inkless, it's a procedure, as it says, inkless. There is no ink involved, but it's mean that it's more work for any type of stretch mark or scars, not for 3D areola. This procedure is to prepare. If we're talking about scars, let's talk about surgical scar. If they are, hypertrophic and they're textured and they're very tight with excessive collagen, it's like doesn't look good. I'm not able to camouflage camouflage it because the color will be uneven and it will not last because of the excessive of collagen. So the inkless procedure for surgical scar, it's actually to prepare it for camouflage if needed. Why? Because this type of procedure can help to make the scar flat and also to restore the natural color of your skin, that is our melanin. Now, if there is too much of scarring tissue over there, so we are able to make it flat with a few sessions, and when it's flat and relaxed and not, textured, so then we actually can implement a skin color. Now, if we take the same procedure, the inkless, but we maneuver to stretch mark, so we target each specific stretch mark with this technique with no ink, and then we make a trauma, we can say, to have a projection of a collagen. So then actually the stretch mark basically disappear because your collagen is repairing itself and your color is restoring. So maybe they're referring to the inkless.
They may be, and I was going to say, because I did want to kind of segue to that too, because obviously the paramedical tattooing is fantastic for breast reconstruction, but we had mentioned so many other things like stretch marks and camouflaging scars and vitiligo and things like that. And when I went to your office, you mentioned the inkless, and we talked about it on the show as well. And people always think of tattoos, be it paramedical tattoos or just tattoos, as being something with ink, which most times tattoos are. But you have the inkless, where you use no ink whatsoever. And when I asked you about how it works, you said, just like you kind of said now, basically, when you have scars, there's too much collagen production, or when you have stretch marks, it's almost the opposite, where you kind of destroyed the collagen, and so you want to build that tissue back up, and so you do the inkless approach, which basically uses needles to traumatize the area. And by traumatizing the area, you create inflammation. Tell me if I'm getting it right now. You create inflammation.
You're good. I'm a good teacher.
All right, yeah. And then with the inflammation, you start to get the regrowth of collagen, and then you're kind of returning the skin back to its natural state. And then once you've returned it to the natural state, if you're not happy with the appearance, then you can still go with the ink approach as well.
Yes, and also the inkless, it's not only for texture, it's also for hyperpigmentation scars. When we have older scars that already are after the stage of the formation and they're already, 24 months already or more, and they healed and their texture and they're hyperpigmented. So with this, we actually able to make it lighter and to balance out this hyperpigmentation to have it as much similar to the skin tone that already exists.
Now, not drawback, but one of the reasons that people like to jump to the use of ink versus inkless, as you said, the inkless takes a little bit longer to get results.
So when we're talking about inkless, yes, because here we're not implement any color that actually, actually had a retention and stayed there. We're actually trying to restore your own natural color. So it takes longer. So if we're talking about, like we were talking about skin tones, Fitzpatrick 1 to 6. So people from 1 to 3, like me, that I'm a light skin complexion, usually every session, if we're talking about surgical scars or stretch mark with inkless, usually it's 8 weeks. If we're talking about dark skin complexion from 4 to 6, like Vivian and you guys, so maybe it can be a little bit longer, but it's very individual. Only because the dark skin complexion is prone for hyperpigmentation, or the opposite for hypopigmentation, and there is a slower healing process. But I will be honest, even people like me, maybe it can take longer because there is other factors, autoimmune disease, Crohn's disease, diabetic. Okay, if someone is taking Accutane, we even cannot touch them for a year because their skin is like paper, So there's so many factors around that. Like, for example, if I will say I will do for myself, I know that I have autoimmune disease, so I know, okay, so I will not be in the 8 weeks, the standard time. If I was perfectly healthy, I need to give myself probably 10 to 12 weeks to see where I am at.
Okay. And the second part of this question, okay, so what is the fastest way to heal after getting a tattoo? And then I'll piggyback my own one onto that. What is the healthiest way to heal? So if somebody's gotten a tattoo, what is the fastest way to heal, and what is the healthiest way to heal? What do you recommend?
Well, the healthier and how to do it everything correctly. First of all, after you have the tattoo done, it should be covered. Minimum 3 days, maximum 5 days. After that, when you remove actually the tape, that it's waterproof, so you can take a shower with this with no issue. You need to avoid exposure to heavy sun exercise for the first 10 to 14 days, no any heavy sweat, and you need to try to avoid before the procedure and after the procedure, even with inkless, to avoid any sweet drinks or food. High sugar,
wow.
slow metabolism, slower healing process.
Interesting.
Ah,
Makes
okay.
sense, actually.
It makes perfect sense, but
Yeah. It's not
And
something I would
if
have
with
intuitively thought
inkless,
about.
and if we do the inkless, so it's also very recommended prior to the procedure, probably like a week or 2 weeks, or even if you do it before, to start to take collagen supplements and to continue after during the healing, because when you know collagen, so it will help to have a very, very healthy, healthy healing. Yeah.
Yeah.
And I've always celebrated my tattoos with a big milkshake. I guess I was like, why they never
Yeah,
healed.
that's
No,
why
I'm
they
kidding.
look so
That's why they
horrible.
never healed. No, okay. All right. All right. So another question. This one is not really related to tattoos, but everybody feel free to chime in. Okay, so we're talking about men's testosterone, okay? And specifically, testosterone as people age. And he's asking, as a man ages, does testosterone go down? And are there natural ways that a man can increase his testosterone? And so kind of something that people don't necessarily know, but we know about menopause for women, right? When you go through menopause, stop having your periods, and estrogen, progesterone, testosterone levels all fall. Men have something called andropause, actually, right? Because androgens, those are the male hormones. So andropause is when your testosterone levels go down. And while for women, it tends to be very precipitous in the sense that, your hormones kind of slowly go down, and then they take a big dive. For men, it's more of a constant, decrease really from early 30s onwards. In terms of replacing testosterone, there are tons of options for replacing testosterone. There are supplements you can take that help. So really anything that's going to reduce inflammation will also help with testosterone levels. So we're talking, ashwagandha, CoQ10, turmeric, all of these things will help. But also there are a variety of creams, there are patches, there are actually pellets. And I'm always very open. So, I was feeling the symptoms of andropause really over the last couple of years. And so I did something that they call it pelleting, where you actually put it like in your flank. You can put it in your butt if you have a butt. I do not. But it basically is a little pellet that goes underneath the skin in the fatty tissue. And then it kind of dissolves, bit by bit, day by day, and you release the hormone and you increase your hormone levels that way. And you do labs before and after. And I saw a pretty appreciable increase, but I could feel it before I saw it in the labs. You do your labs about a month afterwards. So yes, there is something called andropause. It is similar to menopause for women, but unlike women where it kind of slowly goes down and then takes a big drop, men, it kind of just goes down kind of continuously over the 20 years after, you hit your 30s, but very easily treatable. Pills, creams, patches, pellets, tons of options.
Okay. Now, hey, Leon, I wanted to ask you, obviously we're OBGYNs, right? And so all of our patients are basically female. Every once in a while we have a male, but for the most part, female patients. And one thing that I feel like almost every patient complains about to, I was going to say to a man, but to a woman, is stretch marks after pregnancy. And one thing that people will always ask us about are creams. Can you prescribe this cream? Can you prescribe that cream for stretch marks? When people are going to you to treat their stretch marks, do you tend to recommend that they go with the inkless or the ink?
Inkless.
Inkless, okay.
Always
And
inkless.
always inkless, okay. And do you recommend that people wait until after they're done childbearing before they do it? Or can they do it before they're done childbearing?
Well, so I always ask the client, are you done with kids? Because if you're not done with kids and you're thinking to get pregnant next year, just wait. Save your money. I'm very honest. But if they're done with kids and they're good, so yeah, no problem. We can do it because again, it's a process. I also ask them if they're done with kids, but if they're actually trying to lose weight or to gain muscles and they're actually working out in the gym. So then it also doesn't even make sense to work on them. So I needed they will be in the specific weight that they want to get to be able that I actually will treat the stretch mark. But most of my clients, it's also everything mentally. I had a patient that, she had a baby. The baby's already 2 years old, and I asked her, "Are you thinking to get pregnant again?" She said, "Oh, maybe in a year or two." I'm like, "Okay, so maybe we will wait." She said, "No, I'm not waiting. I want it now. I don't feel comfortable with myself. I want to feel comfortable with myself. I want to be, a sexy mom. I want to feel a woman. This baby, took so much away from me. So I understand that it's also something mentally. So in the end of the day, I know that I also will see her now and then I will see her later on. But when I see that they're very, very stressed about how they feel with themselves and
Mhm.
how they look with themselves, and it's something that I know that can help, but in the correct way to do it, because I will not schedule her for like 7 sessions. 7 doesn't make sense, but at least something that she will feel comfortable with herself. And then after that, just to maintain it with hyaluronic acid body cream and vitamin C, just a normal and nice routine after shower daily.
Okay. So we have we're getting close to the end. We've got about 5 minutes left. So I've got one more question, and then I think we'll probably have to wrap up. Okay. So this one is more on the topic of trending news, and the question is, since you're OBGYNs, curious what your thoughts on the comments about whether Tylenol is dangerous for pregnant women. And is it linked to autism in your opinion? And are you recommending your patients to take it or to not take it? So I will say this. I think I know autism is multifactorial, right? There's no one thing that causes autism. And every day, every week, every month, every year, we're learning more and more about all medical conditions, including autism. So do we know everything about autism that we're going to ever know? We do not. However, when it comes to Tylenol and autism, so walking it back a bit, when you're looking at studies, there are multiple types of studies. You want to look for a gold standard study. So you want to look for a study that's double blinded, and that has a large sample size, right? So there are no good studies that are linking autism and the use of Tylenol. Also, just some kind of basic facts. Autism was recognized in the early 1900s. Tylenol didn't even come around until 1960, okay? So is there a link between Tylenol and autism? Can I say definitively no? I cannot, right? Because we're learning more every day. What I can say is that there are no studies that point to that. And so what I'm recommending for my patients, of course, with anything, I think the best practice when you're pregnant is to minimize unnecessary intake of anything, medication, supplements, anything, right? But if you have pain, if you need pain relief, Tylenol, as far as I'm concerned, and as far as the American College of OB/GYN is concerned, and the American College of Nurse Midwives is concerned, it is still safe. It's one of those.
Can I just add one thing? The study that they're citing that said that it may be linked to autism, even the authors of the study,
Right.
at the end of the study, they said, we are not recommending that you no longer take Tylenol. They said just use the lowest effective dose for the shortest amount of time you can use
Which
it.
is what we
So-
always recommend for pregnant patients and people in general when you're taking medications. Take the lowest amount for the shortest amount of time to achieve your goal. So one of those kind of stay tuned things. So we've got like 3 more minutes left. So
I was going to say, I would love if Vivian first, anything you'd like to share for patients out there who may be going through something similar to what you've gone through. Anything you'd like to share with them?
All I can say is do your research, study to show yourself approved, right? The more knowledge you have, the better it is for each individual in their situation. Every
Wow.
case is different. So always go the extra mile. You know, okay, you might be going through an emotional breakdown or whatever you want to call it, but take that time for your self care, to look into whatever you can. Like Liana said, type in cancer, breast, what options are out there, and it'll come up. Google becomes your best friend. But
Yeah.
Google is not always very informative. That's where you have to look at reviews, check, research the doctor, how long they've been in practice. Are other reviews good? That you can have situations like in my case, I had complications when I had my bilateral mastectomy. I had to have a couple surgeries. So my case was a little different than anybody
yeah.
else. So I wanted to repair some of the complications that I had because my skin had died.
Yeah.
So
Yeah.
obviously your skin dies, you have scars, right? So get informed. That's
Yeah.
So I think
basically it. Get informed.
I was gonna say, I think self-care and research are the absolute two take-home messages. Liana, before we go, how can people find you?
Well, guys, you can find me on the Twin Doctor page, my Instagram. You can just Google Liana Resnick and you will find my website and all the information that you need. But what I really want to say that, as you know, I take everything very personally. I take very, very important. It's a mission for me, the medical pigmentation, and to change the community and the education in that. As you know, I did wrote a book and it's already published, and it's for people to learn about medical pigmentation. And I share over there different stories of my patients with their permission and the stories, that it's called From Scars to Strength. And you will be able to learn why I even to get into that and to see what I'm going through every day with my patients and what is their outcome. I even finishing medical degree in billing and coding just to be able to help more patients in what is happening today with insurances. So if you have any questions, just reach out to the doctors, send me a message. Feel free to be, I can say, pain in the ass. This is what it's all about, is to provide information and to provide you the support that you need. Even maybe if it's not the right route for you, it will be still my honor to be there and to help you out and to give you the right direction. So this is what I have to say from the bottom of my heart.
Appreciate. I'm sure people appreciate, and we appreciate you. And guys, please do not forget to watch Second Opinion with the Twin Doctors on Fox 32 Local Chicago and all streaming platforms every Monday. At what time?
7 p.m. Central.
That's right. Thank you guys so much for joining us. Thank you so much, Liana. Thank you so much, Vivian. Thank you so much to all the viewers. Thank you, blackdoctor.org. We will see you guys next week, Monday, 7 o'clock, Fox 32 Local.
Have
And
a
then we'll be
great
here
night.
for the after show
Thank
on
you. Good night.
BD. Thank you guys so much.
Thank you for having
Bye.
us.
Thank you for having
Bye.
us.
See you later.
Bye.
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 I think you want to go hit the button.